Ukraine, of course, faces a number of severe challenges. It is locked in a stalemate with Russian-backed separatists in the east, as you know. And now the World Health Organization is urging the government to declare a state of emergency after 2 children were diagnosed with polio in southwestern Ukraine. Now, the WHO says a vaccination campaign is underway, but it started late and more cases could pop up. But the grinding conflict with rebels is complicating the fight against the disease, as you'd imagine. Our next guest, you see him there, look familiar. You know he spent a lot of time in Ukraine. He's a friend of the show, a very good friend of the show, Michael Borchuk, joining me now. So this is just astounding because I thought the WHO had said that polio had been eradicated at 99%. What can you tell us about these 2 cases of polio that have popped up in Ukraine?
Yeah, well, this is nothing short of a disaster.
Right.
I mean, these are the first polio cases in Europe in 5 years. 2 cases may not seem a lot, but what that indicates is that there are hundreds of thousands, perhaps millions of children that are not vaccinated. Part of the reason for that is vaccination rates in Ukraine, which, as you know, is a modern country, is only at around 50%. It should be at 90 or 95%.
Right. Yeah.
It kind of reflects this perfect storm of parents being afraid to vaccinate. In 2008, a child died after he got the measles vaccine, even though it had nothing to do with the vaccine itself. You can imagine all the negative publicity from that.
Right. So the WHO is now urging the Ukrainian government to declare a state of emergency. What has the government's response been, and what would a state of emergency, in effect, do? The
state of emergency is very, very important because, first of all, it will provide protection, legal protection to healthcare workers in case there's an adverse event, in case there's, God forbid, a death or injury. That's very important. It will also elevate the status of the vaccination campaign. And thirdly, it will also marshal government resources to put into play. Now, so far, the first round of the campaign is happening. It's going quite well from the reports I've seen. But, you know, the government needs to get out there. Celebrities need to get out there. Parents need to get out there who have vaccinated their kids and say this is safe to do so. There's
an ongoing conflict, as you know very well. So obviously, that complicates efforts, right, for a vaccination campaign. And, as you were telling me during the break, I mean, the pro-Russian separatists have made it very difficult for the vaccinations to come into the areas that are under their control.
Yeah, indeed, the health system in the rebel-held areas is absolutely shattered and broken. And the UN officials have told us that the rebels have told them that no Ukrainian procured vaccines are coming into rebel-held areas, that they will take the vaccines from Russia. Now, you know, international standards dictate that these vaccines should be WHO, UNICEF approved. That's the rules that they should follow. Why? Because otherwise, tens of thousands of kids could die in those rebel-held areas.
But what's interesting is that there was precedence in conflict zones where these vaccination campaigns have been allowed to take place despite the fact what was going on the ground.
Absolutely. There are more than 24 armed conflicts where rebels have actually put down their weapons and allowed vaccinators in Peru, Democratic Republic of the Congo, also Afghanistan. And you'll remember, you know, sometimes these arrangements don't hold very well. The rebels, the chain of command could be weak. And remember, in Pakistan, the Taliban threatened to kill healthcare workers, even though they know the benefits of vaccination. So perhaps the rebels in Ukraine can look at these examples and say there is a good case to be made for kind of days of tranquility where healthcare workers can come in.